So immune therapy in some sense is new, and in some senses is based off of ideas that have been developing for a very long time. Paul Ehrlich in 1908 really was the first to conceive of an idea that tumor cells could be recognized as foreign and potentially eliminated by the immune system. Subsequently, Lewis Thomas and McFarland Burnett formalized this concept and coined the term immune surveillance, which really is the first foray into this field. The idea here is that the immune system can normally scan the body for emerging cancer cells and destroy them. And this has been supported by many observations. So when we looked at the slide earlier and looked at risk factors for development of lung cancer, two things stood out. One was patients who are on chronic immune suppression for transplants and patients with HIV, specifically HIV with AIDS. These patients have weakened immune systems, and we know that those patients are at much higher risk of developing lung cancer later on. So the term immune therapy is also very broad, and there are many, many different strategies that use the immune system. These include non-specific strategies, such as bacterial extracts, such as the BCG vaccine, which is sometimes used in early stage bladder cancer. There's cytokine activation. This is called IL-2 therapy. This was previously used in melanoma. It's sort of making a comeback in some experimental immune therapy trials. There's TNF alpha inhibitors. These are more commonly used in conditions nowadays, such as rheumatoid arthritis. You may have heard of a drug called Humira that works by this mechanism, and interferon therapy, which we don't really use anymore. Then there's specific strategies. These are strategies that are really directed towards a specific antigen in the body. And examples of this include monoclonal antibodies. The classic example is rituximab, which is used in B-cell lymphomas. It's very specific for this CD20 marker. There's something called tumor-infiltrating lymphocytes. This is one of the hottest topics in oncology. I'm not going to cover this in this specific talk, but this field as a whole is rapidly emerging and will hopefully have some promising therapies in the future. There's tumor vaccines, and there's immune checkpoint inhibitors. And we'll focus on the last treatment option, as this has direct relevance for lung cancer.